everyone, welcome to GrowMed. This channel is a one-stop guide for the Fmge aspirants, and you can find here everything you need for the exam, like the flashcards, then the mnemonics, then the revision videos, everything. So what you need to do is subscribe to GrowMed and tap the bell icon so that you do not miss any regular study tips. So without wasting much time, let's get into it. So this is a series, the one-liner series, which I have started for the upcoming Jan exam 2025, and already I have uploaded on the other subjects, so you can have a look. And in this video we will be discussing about the micro one-liners which were asked in the past years. So those questions we will be covering it here. So this will be a quick 10 to 12 minutes video, and in that we will cover the important one-liners so that you can watch it in your break time, so that you will be like utilizing the breaks also, okay, break times also. And yes, so the first question: pencil shaped macroconidia appearance on the microscope. This is seen in which kind of disease, so, or which kind of organism shows this pattern? So it is the trichophyton. So trichophyton is a type of the dermatophyte, and it will be affecting the trichophyton, and it will be affecting the nail, the skin, and the scalp also, okay, hair, nail, and skin. Then Bacillus anthracis belongs to bioterrorism agent which category? Category A. So CATE, category A agent it is. Then the next question: immunoglobulin which is found in highest concentration in the blood is the immunoglobulin G. Dimorphic fungi that causes subcutaneous infection, it is the sporothrix. A repeat topic asked multiple times in the exam. So have a look at all the points regarded to this sporothrix. It is also called as this Rose-Gardner's disease, and you can see this subcutaneous ulcers seen. Okay, image based question is also asked on this one, a sporothrix. Parasite that takes entry through the food, so it is the strongyolites. Okay, strongyolites. Then culture media, which is culture media that is helpful in differentiating lactulose versus non-lactulose fermenter. So it is the McConkey agar, and it differentiates between the E. coli and the Neisseria, I think. E. coli and this lactose fermenter. Okay, so yes, this is also an important one, and image based question can also be asked. Rice water stools are characteristics of which disease or which organism causes this rice water stool? So it is caused by this Vibrio cholera, and this is like a hint word given in the question. So whenever you see the things like a child, a young female or male coming with the abdominal pain and diarrhea, rice water stools can be appreciated, and they can give something like about the organism, that the comma-shaped organism can be seen in all these things. So if a clinical case is asked, so this rice water stools will help you to come to the conclusion that it is the rice Vibrio cholerae that is causing this diarrhea. Then the next question, so history of travel to Ohio is there, and after that the patient will be having lung infection. So what will be the disease? So it is the histoplasmosis, a kind of fungal infection. So this is a fungal dimorphic fungi, and it will be affecting the lungs, and similar to this TB. So it can be present with the necrosis also, caseous necrosis also, and cavitation also can be seen. Okay. Then orchitis is an important complication of which disease? So mumps causes this orchitis, and if a clinical case is asked, then they can describe the features of the mumps, and they can ask like a child is having orchitis, like pain, orchitis, and some other features will be described, and they'll ask what is the cause. So it will be mumps. Safety pin appearance is given by which bacteria? So it is the Yersinia pestis. So this one will be giving the safety pin appearance. Then condyloma acuminata, this is caused by which virus? So HPV, human papilloma virus. Asked like this one is asked in derma, OBG also, then this also, and sometimes in PSM also. Okay, so yes, condyloma acuminata image based question can also be asked. Granuloma inguinale, this one is caused by which organism? So it is caused by Klebsiella granulomatis. So this is the organism which will be causing this granuloma inguinale. Then the stain which is used for the TB is the ZN staining. Okay, so it is a special kind of a stain, and for the fast acid fast staining we will be using this TEP. Okay, then cost effective test for the diagnosis of the syphilis, it is the dark field microscopy. Then the next question, sclerotic bodies are seen in chromoblastomycosis. So sclerotic bodies, also note it down like a keyword. So whenever you see sclerotic bodies or brown bodies and in the option chromoblastomycosis is there, go with the chromoblastomycosis. And chromoblastomycosis is also a repeat topic. Okay, so they will be giving like a forest worker is there and he has some infection of the foot, and you can see the sclerotic bodies. Okay, then most common cause of the prosthetic valve endocarditis, so it is the staph epidermidis. Also another point remember about this staph epidermidis is that it is the normal skin flora. Okay, so normally present on the skin, and whenever this prosthetic valve it gets access to the bloodstream, it can cause this endocarditis. Okay, then culture media used for the Clostridium perfringens, so it is the Robertson cooked meat media. Then Chlorhexis syrenensis is associated with the risk of, so this organism or this parasite increases which of the following risk of disease, so it is the cholangiocarcinoma. Okay, then lab test which is used to diagnose the rotavirus diarrhea, then it is the antigen in the stool. So this is the confirmative test for this one, for the rotavirus diarrhea. Sporulation of bacteria is seen in which phase? So it is seen in the stationary phase. Okay, so this one is also an important topic, the phases of the bacteria, like what all will be happening in which phase, the log, the lag, the stationary and the declining phase. So have a look at that also. Organism that can't be grown on the artificial media is the Mycobacterium leprae. So this one cannot be grown. Then the next question, so scopes, these are sterilized by which chemical? So it is the glutaraldehyde. So remember one sentence, that all the scopes are sterilized by glutaraldehyde. So whenever they give the endoscope is sterilized by which, so it will be glutaraldehyde. Then the last question, DNA transfer occurring via a bacteriophage, this is called as transduction. Okay, so yes, transduction, these were some important one-liners asked in the past years, and expecting that some of these can be repeated or asked in the upcoming exam in a different pattern. So the pattern of question can change, like they can give a case, or they can give an image, or they can just simple give a one-liner. Okay, so you should be ready for all kind of the things asked. So yes, already I have uploaded the videos on the other subjects discussing the important one-liners. Have a look at them, and there's also a video with the name of 10 most important topics from the micro. The link is given in the description box, so do watch that video as well, because I'm sure that it will definitely help you, and one or two questions from that video will be coming. So in a very short time I have discussed a lot of important things, so it will be very good for your recall sessions as well. So yes, thank you so much for watching this video. All the best for the exam, and I am Dr. Padmini, your mentor for the FMGE. Like the video, share it with your friends, and subscribe to GrowMed. Thank you so much guys once again. Bye bye.